We're always getting questions in the group of parenting aging parents about, okay, what do I do? Because we're just planning ahead. We want to
Mhm.
look for extended care, long-term care, however you want to describe it.
Mhm.
But where do I start? What do I do? Who do I talk to? And so many people have questions and don't know where to turn.
We are going to bring to you today Mickey Batsell. He is a senior care consultant, as well as someone who actually goes and trains people who are in the senior industry. So you've got a lot of experience, Mickey. We're glad for you to be here. And I think that the first thing is, as we're hearing from people who are wondering how to do this, it's at least good that they're asking, right? Because I think the first thing that's so important about thinking about how are we going to care for our parents for the long term is, where do we start, and what kind of plan can we put in place?
Yeah, it's a very difficult situation because for many people, it's the first time they've ever been kind of thrust into the firing line. Um, and it's a subject that a lot of the financial planners that are out there, or consultants that are helping clients, don't really know or don't really understand. So they're a little embarrassed to even bring it up. So you've got to have somebody that knows what they're talking about.
So let's just start with talking about why it's so important to have kind of a plan and to have thought through these things before you actually need it.
Well, it's important to know if something happens to mom or dad or to you or your spouse, are you going to be able to handle it by yourself? Most likely not. And where do you go to get the kind of help that you need? And some of it involves volunteering, but most of it is going to involve somebody that's, it's their profession. So they have to get compensated for helping out. And it can become pretty expensive. We often hear people avoid the conversation about long-term care and long-term care insurance because the first thing that comes to their mind is a nursing home. Well, a nursing home is a place that people really don't want to go to, and it's the last resort. Most extended care takes place in the home, and most of it, as a matter of fact, is provided by family members or friends, and it's exhausting, and you need some help. You need a break. I had a situation with a client that lives in Colorado Springs, and she was trying to take care of her husband. And this happened just about 3 weeks ago. She had a heart attack from all the stress. When I saw her earlier this year, I told her, I says, you've got to get some help. You can't do this. It's just too stressful. Well, it took an event like that for her to realize, and they had policies in place that they could have been using, but they're afraid they're going to spend it down.
Yeah.
It's a tough situation, but you got to have that conversation.
Yeah. You mentioned long-term care insurance. I think a lot of people are confused between long-term care insurance, long-term care, because you don't go to the same people for both. Am I correct?
Well, that's correct, because for someone to acquire a funded long-term care insurance policy, it has to be sold by a licensed insurance agent.
Right.
But long-term care can come from a home care agency. It can come from a spouse. It can come from a child. But those don't require any particular licenses unless you're working for a home care agency. Then the agency has to be licensed appropriately. Right. The big difference, though, when you're talking about a home situation, is that there's what's called professional care, which are provided by, it's called skilled care. And skilled means doctors, nurses, people who have a medical background or medical license. But home care, for the most part, is non-professional. It's non-skilled, and it's people helping with the everyday chores and dressing and those sorts of things. Completely different than medical care.
So, as the adult child, and we're trying to plan ahead and be prepared. What's the first thing that what's the first thing that we need to do to start trying to create that long-term care plan, or that plan for extended care for our parents?
Well, I think evaluating your family situation is probably the first step. I have the conversation a lot, and I said, well, if something should happen to you, what is your plan in terms of assistance? Who's going to help you? Well, I don't really, I think that our daughter or our son is going to take care of us. Well, let me just refresh my memory. Your son is a successful attorney in Washington, D.C. area, and your daughter is a physician in Salem, Oregon. Now, which of those are going to quit their job and come spend time with you and help take care of you? The reality is neither one. But too many people in the old days, particularly here in Texas, the farmer had the farm and the older son gets married, builds a house right next door.
Mhm.
That was their long-term care plan, because if something happened to them, the son and his spouse and kids were going to take care of them. But it isn't that way anymore.
So I guess first step is actually have that conversation with your family to find out kind of what the wishes might be, one of the parent, but also the availability of the children. Is that kind of what your thoughts
That's
are?
helpful, because in every family, you have children that have certain skill sets. There's going to be one that's going to be a caregiver, just by nature. The others have nothing to do with it. And
If you have enough children, right?
you have enough kids, you got to rent somebody,
And
Well,
you went through some caregiving with your mother, correct? So
That's correct.
besides just on the business side, from personal experience about the time and the money that it takes.
Yeah, and it was particularly challenging because I grew up in Phoenix, Arizona, and that's where my mother lived, in the same house they built in 1958. My dad passed away in 2000, and mom lived by herself. And so when her health started deteriorating, I'm in Austin, Texas, and my brother's in Colorado Springs, and my other sister's up in the Dallas-Fort Worth area. So I spent time going back and forth, particularly the last 6 months of her life, helping out. But then it was something that I couldn't do. We didn't have the right kind of opportunity for her, because her health wouldn't let her qualify for a long-term care policy. But we did something that 3 years ago that really saved the bacon, and that was that her home was paid for, but it had grown in value. So we did a reverse mortgage, and we had those funds available to help pay for the care. But we couldn't pay for the care forever, because home care, which is non-medical in nature, runs between $20 to $28 an hour. So for about 3 months, we had to have somebody in the house, in the home, that was a professional caregiver, and that was running in the $23,000 a month range.
Wow.
Yeah.
I can tell you, it hurts to write a check that big every month.
Yeah. Well, and it's not I mean, even if you can do it in the short term, that's a hard thing to sustain.
Yeah.
If it's for even longer period of time.
It truly is, and that's why you've got to have a plan in place. For the short term, maybe you can do it for 2 or 3 months, but in the long term, I just had to have a talk with mom. I said, "Look, mom, we can do this till the end of the year, and after that, the only alternative for you is going to be qualify for Medicaid, and you don't want to be in a facility." And I knew she didn't. So we found a home. It only had 9 residents in it, and every room was a private bathroom, private room, and a sliding door to the outside, so that we could get some sunshine. But it was about a third of the price.
So I think that's a great point, is just that knowing that there are so many different types of care, it's not just the traditional, you got to be in a big nursing facility or skilled nursing or whatever it is. There's lots of different options. The other thing is, I think, thinking through, okay, so I have a question. Is there a difference between a long-term care plan and a long-term care insurance?
The difference is that you have to have a plan in place. The long-term care policy may be a part of the solution, but there may be some other part of the solution that puts the whole plan together. But the policy is not the plan. The policy is just a safeguard and a method to help fund whatever the plan is.
Okay. So it's really more just, and I know this may sound not very, very, very smart of me, but is like creating that long-term plan is just having those discussions with your parents, having an idea of what their financial abilities are, so that you can kind of, is it literally like putting together something in writing that says, this is the first step, is knowing that, okay, we have a sibling that can be the caretaker or caregiver, or we don't, or they have a home that we can do this, or they want to stay at home, or they want to go to a retirement community, but like really literally just coming up with as things progress, or if they progress, because some people don't.
The important aspect of this whole plan is that you want to put this plan together while everybody's healthy.
Right.
You don't want to wait to have to be pinned up against the wall, and your decisions are very minimal. Choices are minimal. So, and it's tough without getting the input, because you would want to make sure that you were doing, what was your parents, what do they want to do? What did they say they wanted to do?
Yeah.
And we'll try to put that thing together. And if we can, yes, if we can't, we'll have to alter the plan a little bit.
Yeah, I think that most people, maybe not all, but most people who are watching this are in one of two boats. Either they're number one, they're a planner and organizer, kind of like me, and they're looking ahead. They're going, mom and dad, they're kind of an independent living right now, but we're going to need something in the not so near future. So what should we do? So the question for you is, what do those people need to do?
Well, if that's the case, then you have to see what resources are available. The difference between, as we've already talked a little bit about, between skilled care, which are the medical people, and the home care, which are not the medical people, but they help with the chores and cooking and everything else. And sometimes you reach that point, as we did with my mom, where she couldn't do the cooking anymore. So we had to have somebody to help with the meals. And you could even do that for 4 to 6 hours a day to give the other caregiver a relief, so that they could go run some errands and do the things that they needed to do too.
So do those people, are they looking more for insurance, or are they looking for what I'm going to use for in the future, and how much is it going to cost?
Because I think unfortunately the financial piece is a huge piece, right? As far as what they'll be able to afford.
It is the driving force. It truly is. And what's available? How can you access it? If it's someone who has qualified funds, which is an IRA or 401k, how do they, what are the tax consequences are? What are the pluses and the minuses? What's the best way you can set it up? There's a lot of moving parts to this.
So what type of person do they need to talk to right now? Should it be
they need to
financial planner, an insurance agent?
Well, they need to talk to someone who has had experience. You can look for, there's a couple of certifications that people can have. One is a certified senior advisor, CSA. And those are folks that spread the whole gamut. They're people that they're home care, they're assisted living folks, they're agents who specialize in long-term care insurance and long-term care planning in that respect. So that's one certification or designation that you can look for. The other one is the Certified in Long-Term Care, CLTC. And those are people that primarily are in the financial arena, who have gone through a training and passed an exam, so that they understand the entire process for long-term care planning. So those are two that you can help.
Okay. And the second group of people is something happened to mom or dad now. We need long-term care now, extended care now. Who do I talk to then?
There are home care agencies. There are doctors. I mean, if you're talking medical, it's one thing, but if you're talking just home care, it's a different scenario. But there are home care agencies. Some of them are franchised, some of them are independently operated, but it's an entire industry to itself.
Right. Okay.
Good. Lots of stuff to think about.
Yeah. I think this herein, in this short amount of time, it's hard to, we can't answer all the questions but it also just shows that there is a lot of confusion. There's a lot of moving parts, and there's just a lot to know. Yeah.
Well, and also if your financial advisor is one that doesn't really have the expertise, most of the time they'll know someone that you can contact to help out too.
Okay.
Mickey, thank you so much for all of your help and all of your advice.
Well, I certainly appreciate the opportunity, and I'm glad to help anytime I can.
Thank you.
Thank you. I tell you what, it's just something that it's just
it's hard. Your head starts spinning a little bit. Just
thinking about it. And you're thinking about your mom, my mom and dad, both kind of in different places. And it's like, okay, what do we do? And how do you plan? And it's hard to get everything on the same page, but it can be done.
I think first thing starts with the conversation, right?
Exactly.
With your parents and just
conversation and your siblings, and just try to get on the same page.
Yeah.
If you have other things that you'd like to talk to, you'd like for us to talk to experts about, let us know here on Parenting Aging Parents.